Hello, everyone, and welcome to today's digital event, Professional Development and Advanced Training Opportunities for Pharmacy Technicians. I'll serve as your moderator. My name is Ryan Burke, and I serve as the Director of Professional Affairs at the Pharmacy Technician Certification Board, which is the largest credentialing body for pharmacy technicians in the United States. I am a pharmacist by training and have previously worked at the American Pharmacists Association. And now in my role at PTCB, I work with lots of PTCB stakeholders, which include regulators here in the United States, employers, educators, and really anyone that has anything to do with pharmacy technician practice here in the US. A few announcements before we get started with today's program. The webinar is being recorded and live streamed via YouTube. After the event, the recording will be available on our website, events.fip.org. I encourage you throughout the webinar to enter your questions using the question box provided on your screen. And we always welcome your feedback via email at webinars@fip.org. And finally, if you are not already a member of FIP, I strongly encourage you to consider joining. And you can learn more about that at fip.org/membership_registration. So we have an excellent program planned for you today. We have two amazing speakers, one from the United States and one from the United Kingdom, who are going to share their perspective and some information about training, education, as well as continuous learning and professional development in their respective countries. And then we'll have plenty of time at the end of the session for questions from you. So as you listen to each of the speakers, please think about what you would like to ask them. And again, enter those questions in the Q&A box provided on your screen. This is what we hope you will take away from today's session. So one is recognize strategies for continuous learning and professional development. Two is to identify professional development opportunities that are designed for pharmacy technicians. And three, describe advanced training programs that are available for pharmacy technicians. So now it's my pleasure to introduce our first speaker, Nichole Foster from the United States. Nichole is the Program Director of the Pharmacy Technician Education and Training Program at Vanderbilt University Medical Center in Nashville, Tennessee. She has more than 19 years of experience in many facets of pharmacy practice and is very committed to growth and advancement of pharmacy technicians. Her efforts to advance pharmacy practice for technicians at the state and national level have earned her the honor of being the first pharmacy technician to receive the Distinguished Service Award from ASHP in 2020. Nichole has earned her master's in education, business administration, and also has an advanced certified pharmacy technician credential. She's a member of the Pharmacy Technician Accreditation Council at ASHP and a member of the Certification Council for PTCB. Nichole, welcome, and thank you for being here with us today.
Thank you so much, Ryan. It is an honor to be here to speak about pharmacy technician practice in the United States. As Ryan stated, I've been in this profession for over 19 years. I started the summer before I started university or college, as we like to call it here in the United States, and didn't really know what I wanted to do with my life and my career. Knew I wanted to do something in healthcare, but didn't really honestly realize the options that were available to me in the pharmacy field, actually not being a pharmacist. So today I want to go over what that means to be a pharmacy technician in the United States and the training that we receive. So our next slide. So we're going to talk about education and training programs in the United States, what it means, what standards we go by. We have the American Society of Health System Pharmacists and ACPE standards that we follow, and then what that means in regards to getting your certification through the Pharmacy Technician Certification Board, and then specifically talk about the program, the model program that I run at Vanderbilt. So compared to other allied health professions, being like a dental hygienist, medical assistant, surgical technologists, veterinary technicians, or EMTs that work on our ambulances and respond to emergencies and things like that. This kind of highlights the difference in training pharmacy technicians receive. Most programs are between 8 to 15 weeks. Some of them are a year long. It just kind of depends on how their actual program is structured. We do have programs in the United States that offer associate's degrees along with their training. But for the most part, they're between 8 and 15 weeks at the minimum, depending if they're an entry level or an advanced. So that's kind of how they stack up related to the other allied health professions. And then we look at how do you become a pharmacy technician in the United States? So there's actually a couple different ways you can start that process. So one way would be to enter the profession through an employer-based training program or just through employer-based entry. So that would mean getting a job at a pharmacy, depending on our state regulations and requirements. Some states require that a technician is actually certified nationally before they can work in a pharmacy, but there are a lot of states in the United States that do not require that. And so you have to have a minimum of 500 contact hours in order to sit for the PTCB exam. And so a lot of people just start working in a pharmacy and get that on-hand work experience and training. And so we have two different types of board regulations. So we have our state licensure or registration. Some states call it a registration, some states call it a license. And so that just means that it's monitored and regulated at the state level. And then we have our national certification. Our main accrediting and certifying body in the United States for pharmacy technicians is the Pharmacy Technician Certification Board, or PTCB. And then you can go to a formal training program or receive formal education. So that would be like the program I run at Vanderbilt and other training programs that are recognized by PTCB or accredited through ASHP and ACPE. Some programs like mine are currently seeking accreditation, and like I have my site survey in May of this year coming up, and some are not accredited but are recognized by PTCB. So there are 3 types of exams that you can actually take to attain this certification. And so we have the PTCE, which is offered through PTCB. There's a lot of initials in pharmacy. And so that one is the main one that we see at our institution that our technicians take. And then there's the EXCPT, which I believe is offered through NHA and a few other accrediting bodies. And then some actually are just a state level exam that states require for the technicians to take in order to become certified. So those are your main ways to enter the profession. So when we're talking about formal education and training programs, there are some education and training programs that offer a certificate and or degree, and that could be offered in a community college setting or a technical school. There are colleges of pharmacy that not only offer our PharmD or doctorate of pharmacy in order to become a pharmacist, but some also offer technician certification training programs. And then we have employer-based programs. There are big chain or community pharmacy chains in the United States that actually have employee-sponsored training programs that their employees can take part in while they're working and getting their experience. Another really neat initiative we have is high school-based programs. I think some places call them secondary. And so this would be the latter part of your education before you start university or college. And so these high school students sit through these classes and get these trainings and do experiential hours. And by the time they graduate high school, they actually also have the opportunity to sit for this national certification. Our military actually also sees a value in technician training programs and offers a track through our military to receive that training as well. There are certification review courses and distance learning programs that you can pay for and do completely online, and then also sign up to do your experiential hours as well. So there's a lot of different facets of education and training programs available in the United States. And then after that, we have on our next slide, I believe, we have ASHP and ACPE accreditation standards. And so our main accrediting body for pharmacy technician training programs is ASHP. I'm a member of that accreditation council. And we go around the country and do site surveys for different programs and make sure they're meeting the standards so that we're holding all of these programs at one standard and making sure that there's consistency and continuity through those training programs. The purpose of that is to protect the public by ensuring the availability of a competent workforce. We want to make sure all of our technicians are trained similarly and can all do the same job. To describe pharmacy technician education and training program development at an entry level and an advanced level, which we'll talk about here in a minute, and to provide criteria for the evaluation of new and established education and training programs. They also promote continuous improvement of established education and training programs. So that just basically means once you get accredited, you also have to re-certify and get reaccredited over a time so that you don't just get accredited once and then you can kind of do whatever you want. It's made that way so that over time you have to check in and make sure that you're adapting and changing as the field changes as well. So next, we have the standards that we hold programs to with ASHP. So if you are trying to get accredited through ASHP in the United States as a pharmacy technician training program, these are the 15 standards that we would evaluate you on. And so there's, and it's the 15 standards that also need to be, like everything you do in your program has to include some of these standards. And so we want to make sure that the program is teaching prospective technicians personal and interpersonal knowledge and skills, foundational professional knowledge skills, processing and handling of medications and medication orders, patient care, quality and safety knowledge and skills, regulatory and compliance knowledge and skills. And then we want to make sure that they understand the authority and responsibility that's provided to the program director that oversees each of those programs, that they have a solid strategic plan, that they have a competent and fully developed advisory committee to help them make decisions such as curriculum, like changes to the curriculum and changes to their strategic plan, that their curricular length is sufficient for our standards for the program, and that the composition and delivery of their curriculum, including what it means if we have people doing it remotely or distance learning type programs. And then making sure that every program is using a standard process to recruit students, to accept those students into their program, and to track their enrollment and then represent the program. And then we also look at the faculty and instructors for the program, the qualifications that are required for those people, and making sure that is consistent as well. Documentation is a huge thing. You have to have loads of documents and files upon files of everything that you do, whether that be the type of grades you give your students or the type of labs that you conduct to teach non-sterile or sterile compounding. Everything needs to be documented thoroughly. And then there's a thorough evaluation and assessment of competency expectations and of structure and process. We basically look at everything from the top to the bottom of those programs and make sure that everything that they're doing meets the learning objectives and standards and competencies that we want our technicians to have. So after that, we have on our next slide, different levels of pharmacy technician training programs. So I mentioned this earlier, we have two main levels. We have our entry-level program, and that program prepares students for practice as an entry-level pharmacy technician in a variety of settings, whether that be community, which is like a retail pharmacies, hospital, home care, or long-term care. And it also makes sure that students acquire knowledge, skills, behaviors, and abilities needed for such practice. So students that come out of entry-level programs are ready to enter the workforce kind of green and new to that workforce and able to kind of fulfill those basic entry-level roles. We do have standards for advanced level programs. These programs prepare students for practice at that advanced level in a broad range of those advanced roles, still within the community, hospital, home care, and long-term care setting. And it makes sure that they gain the same knowledge, skills, behaviors, and abilities of the entry-level program, but then also add additional skills and training for advanced practice. So that could be something as going deeper into sterile compounding, covering billing and reimbursement, and just a variety of scope of practice that we can add on to additional services so that the technicians that graduate from these advanced level programs have additional training that would allow them to be able to step into more advanced roles within our community. So what does that mean curriculum-wise? What's the difference? And so our entry-level programs, we require them to complete 400 hours, which is around 8 weeks. And the advanced level is 600 hours. So it's everything that includes the entry level plus additional time. So it's 200 extra hours. For the entry level program, we have 300 hours that are divided into didactic, simulated learning, and experiential learning. And so our didactic portion, just like the education, the lecture, the textbook work, things like that, is 120 hours. The simulated learning, which would be our labs, on-hand practice, role playing back and forth, situational analysis, things like that, is about 50 hours of the program. And then our experiential, which would be like our on-site clinical rotations, working in pharmacies, working with providers, working with pharmacists, is 130 hours. And then there's 100 hours to play with. The program director can actually add in. Ours is a health system-based program, and so we add in a little bit more about hospital and compounding. So our technicians are a little bit more prepared to get into that hospital workforce. The advanced level program, they take 460 hours and divide that over that didactic, simulated, and experiential learning. So they're adding 40 hours to the didactic, 50 hours to the simulated, and then 70 hours more for the experiential. And then they actually give them 140 for whatever the program director sees fit. So we have certification versus certificate programs. So PTCB actually offers like our pharmacy technician certification, and then they also offer assessment-based certificates. And so the differences between those is for a certification program, we would recognize professionals who meet established knowledge, skills, or competencies. And then an assessment-based program would actually build on those capacities and recognitions into a specialty area of pharmacy practice. So basically what that means is we test everybody's skills and knowledge base at the basic level to become a certified pharmacy technician. Once they get that certification, after they've spent a certain amount of time practicing as a pharmacy technician and taking additional training, they can actually sit for exams in specialized areas. And so we'll, here in just a minute, we'll have a slide, we'll talk about those different areas. But so it's a way to build on that knowledge for pharmacy technicians and gain additional certificates to say that they're trained in those specialist areas. So next, on our next slide, it is the types of certificate programs that are offered through PTCB. So we like to give little badges that people can like put in their email signature or put on their LinkedIn profile and things like that. So that first tealish green colored one is our certified pharmacy technician badge. That would be for anybody that passes that PTCB exam and becomes a certified pharmacy technician. We also have an additional certification exam for technicians that complete training and complete competencies for sterile products certification. Sterile products is highly and strictly monitored in the United States. And so we have an additional certification for those technicians so that they can showcase that they are highly skilled and trained and obtain that additional certification. I'm actually a CPHT advanced. And so what that means is I am a certified pharmacy technician, but I have completed 5 or more of these additional certificate programs. So that puts me in the advanced category. So that's our top 3 certifications that we have available through PTCB. Our additional trainings and certificate programs that we have for technicians are billing and reimbursement. So how we bill for our medications, how we get reimbursed for those drugs and services, hazardous drug management, medication history. So we have technicians that will go around and actually take medication histories on patients and assist our doctors and nurses throughout that process. And technician product verification. Right now, in the state I live in Tennessee, technicians can actually verify products prepared by other technicians in a hospital setting or in an inpatient setting. We're working on getting that rolled out to our community settings, but right now it's only in our hospital setting or inpatient setting. And so, and there's strict regulation on what they can actually check, prepackaged items that are barcode scan enabled and things like that. And the technician product verification actually varies state to state. Some states don't allow it at all, and some states allow in both settings. So it kind of just depends on the state in which that is allowed. It's no secret that I'm sure internationally, and especially in the United States, there are pockets of areas where we have a real problem with controlled substance diversion. And so we have a specific certificate program for controlled substance diversion and prevention. Since COVID, we have really seen an uptick in the amount of technicians that are administering vaccines. And so we now have immunization administration as a certificate that's available for technicians to get certified in as well. We also have point of care testing because we have a lot of pharmacies that are located in clinics and clinic-based pharmacies. And so this allows pharmacy technicians to be able to complete those point of care testing services if it's allowed in their state. And lastly is medication therapy management. A lot of our Medicare and Medicaid programs require that we review patients' files for medication therapy management, just basically making sure that they're not on so many meds that are counteracting with each other and making sure that maybe we can get them at a lower cost for the patient. And so a lot of our pharmacy technicians and pharmacists do that on a daily basis for a patient caseload. And so this just shows that that pharmacy technician has the ability to perform at a higher level for that specific area. And we have some more programs that are going to be rolling out for our future certificate programs. We're working on supply chain management because we realize getting our products to our pharmacies is very important, and there are people that specialize in that. Regulatory compliance, meeting these ASHP standards, meeting Joint Commission or different accrediting bodies, like who controls that compliance. There are teams of technicians and pharmacists that's all they do all day long is look at compliance and make sure that their organizations are following that. So we want to offer that as something that technicians can get a certificate for as well. And then also non-sterile compounding. It is just as big of an industry here as sterile compounding. And so we want to make sure people are recognized for that training as well. And so in order to sit for these certificate programs and exams, you would need to be a PTCB certified pharmacy technician. So what does my program do? I'm the program director for the Pharmacy Technician Training Program at Vanderbilt University Medical Center in Nashville, Tennessee. We like to call it Music City. It's the heart of country music in our great nation. And we are an 864 licensed bed hospital. We are a level 1 trauma center. We are the largest hospital and health system chain in the southeast corner of the United States. Some statistics about our hospital. We complete almost 40,000 surgical procedures a year and almost 2 million ambulatory visits, around 67,000 emergency room visits. We have actually over 25,000 employees in the downtown and Middle Tennessee area. We have loads and loads of volunteers that help us. And right now, between our adult and children's hospital here at Vanderbilt, we have over 800 pharmacy employees. We were named to the Best Hospitals Honor Roll in the United States, top 20 of adult hospitals. We are the #1 adult hospital in Tennessee and in the metropolitan Nashville area. And we were 10 nationally ranked adult specialty programs, with 3 of those being in the top 10 nationally. So we are a very large institution and organization that has a lot of outreach for our state and the Mid-South district area of the United States. So our training program at Vanderbilt started in January of 2021. COVID actually delayed the start of our program. It was supposed to start in 2020, but we wanted to make sure we were aligning our resources and things to help combat this pandemic. And so we wound up actually launching our first class in January of 2021. We are currently in candidate status with ASHP and ACPE. We will have our site survey this May, to where, fingers crossed, they will grant us full accreditation and we will be an accredited program. And that will be retroactive to our graduates that have already completed our program. Our program is 20 weeks in length. The first 12 weeks of the program, the students go through didactic learning, simulated lab learning, and they spend 1 day per week in class. And the rest of it is kind of done online at their own pace. The last 8 weeks of that program is their experiential learning. They spend 4 weeks rotating through various inpatient settings, and then 4 weeks rotating through various outpatient or ambulatory settings. We host 2 cohorts per year or annually. We start one in the fall, like we like to call it. So it usually starts around August, and then we'll graduate in December. And then we start another cohort in January that'll usually graduate in May or June. So what are our statistics? What does it look like? How have we graduated? So overall, we have a 77.78% pass rate for the national exam, and 75% of our students that have registered and started our program have completed it. Right now, it's really hard to retain students. I have gotten to the point where I'll start 8 students in my class like I did this time, and only 5 have made it so far into the point where they just drop for various personal reasons, financial reasons, medical reasons, things like that. And some of them just don't hold up the grades through the program to be able to complete it. But the great news is that overall, we were able to, and so far have been able to retain 88% of our graduates into positions within Vanderbilt health systems. And so it's been a great thing to feed our program, or to feed our positions in our hospital from this program. So it's been pretty great. And next we have our program layout. So as I was talking about before, we have classroom learning during that first 12 weeks and simulated lab. Like I said, they attend class 1 day per week for 8 hours, and then they spend the rest of that time doing online modules, taking quizzes, exams, and doing written assignments that they submit online for credit. Next, we have the experiential learning or hands-on clinical rotation. They spend 8 weeks of that, like we said, into 2 different capacities, outpatient and inpatient rotations. And luckily, we are such a large organization within the Vanderbilt health system that we do not have to send our students outside of the Vanderbilt health system. So we're able to keep them on site. And next, on our next slide, this is just a simple little slide that has examples of what textbooks we use. We use 3 main books in my program, and we have the Pharmacy Technician, which is our basic core textbook. We have a supplemental medication workbook for pharmacy technicians to help them understand more of the pharmacology base of this profession. And then the biggest thing is pharmacy calculations. We really hit that really hard because like calculating doses for sterile compounding and things like that. We want to make sure they have as much of that under their belt as they can, and that they feel good about that before they complete the program. And so this is just a mock-up of what our lesson plan and assignments look like. And so it kind of outlines for you basically like the textbook chapters that we go over each week, the calculation and medication workbook chapters that we go over each week, and kind of what that format goes through. We usually have a quiz, a test, an exam, a case study, a lab of some sort every week that they submit for credit. And then also it outlines here our lab activities and the things that we talk about. So we do practice giving injections, and we talk about top 200 drugs, and practice geometric dilution, etc. So there's a lot of activities that we show our students. And we also thoroughly go over aseptic technique, garbing, injections, and things like that. So. And that's all for me. So thank you so much.
Thank you, Nichole. I know that I have quite a few questions for you, and we have one that we've already received in the Q&A, but we'll save those for the end of the program. And I'd like to encourage everyone, if you have questions for Nichole, to please go ahead and submit those, and we'll get to them in just a bit. So with that, it's my pleasure to introduce our next speaker, Catherine Watkinson. Catherine is the head of medicines optimization and pharmacy services at Turning Point, a very varied role across substance misuse, learning disability, mental health, and public health services. During her career, Catherine has held a variety of positions in NHS mental health trusts and general hospitals. In addition, Catherine sits as part of the GPHC investigating committee as a registrant member. Catherine has held the position of branch liaison executive at APT UK since November of 2020, and she has been an active member of APT UK throughout her career, having previously held both the national treasurer post and roles within local branches. So Catherine, welcome. Thank you for being here. We look forward to hearing your presentation.
Thank you very much. It's a pleasure and a privilege to be with you all today. So As Ryan's highlighted, I'm here today in my role as the branch liaison executive for the Association of Pharmacy Technicians UK. APT UK is the professional leadership body for pharmacy technicians across the UK. We provide the lobbying for government, for the NHS, to promote the role of pharmacy technicians, to support the advancement of pharmacy technician careers. We work very closely with the General Pharmaceutical Council, the GPHC, to ensure that the regulation of pharmacy technicians is fit for purpose and reflective of the roles that we do. So next slide, please. So I'm going to look at the current qualification routes and regulation of pharmacy technicians across the UK. It is slightly different. The UK is England, Scotland, Wales and Northern Ireland, and currently Northern Ireland have slightly different regulation to the rest of the nations. What the revalidation requirements are for pharmacy professionals in the UK when they're registered with the General Pharmaceutical Council, what's currently available for pharmacy technicians as they advance through their careers, and where potentially the gaps are, and what opportunities there are for further development and to increase those opportunities for pharmacy technicians. Next slide, please. So there's been a really big shake up of initial training for pharmacy technicians. Prior to 2019, pharmacy technicians had to do 2 courses in order to qualify. So it's a 2-year training period. It always has been, but it used to consist of 50% of the training was educational. So people would go on day release to college or on week blocks to college or do distance learning for the underpinning knowledge. And alongside that, they would do work-based learning for the practical competencies. What's now happened is that's been brought together into an integrated programme. So all courses have to meet the initial education and training standards that are laid down by the General Pharmaceutical Council. And it was recognised in 2019 that they were no longer fit for purpose. A lot of the emphasis was on roles that pharmacy technicians no longer undertake routinely in the UK. And there wasn't enough emphasis on some of the more advanced roles that we do now. So in the UK, there's been a real big move away from pharmacy technicians dispensing. We do a lot more work on medication reviews, in primary care, in supporting patients rather than kind of in the more supply roles. So there's been a real overhaul of those qualifications to make sure that the pharmacy technicians that are coming through those education pathways have got the skills and the knowledge and the experience that they need to be operational. The majority of funding is through apprenticeships. In the UK, as soon as an employer employs above a certain number of staff, they have to pay into a government pot for apprenticeship funding. And the vast majority of apprenticeships and of pharmacy technician initial training is now paid for through apprenticeships. And as part of that, at least 20% of the training has to be off the job. So people, if they're working full-time hours, will work 4 times in a pharmacy or in a hospital or in a GP surgery. And the remaining day they will spend purely on their education. And as part of the new initial education and training standards, traditionally the training was all either within a hospital or within a community high street pharmacy. And increasingly pharmacy technicians in the UK are working in other settings. So they're working in clinics, they're working in general practice, they're working in primary care, they're working in care homes. And the new initial education and training has actually opened up those opportunities. So we're now doing increasingly cross-sector training. So people might do half of a year working in the hospital, another half of the first year working in a community pharmacy. Then they'll do another 3-month placement, perhaps in primary care, in a GP surgery, in industry. We also have pharmacy technicians in the military. So there's a greater opportunity to get a wider exposure to a variety of settings through that initial training period. And all pharmacy technicians in England, Scotland and Wales are registered with the General Pharmaceutical Council. So you have to have a minimum of a 2-year training period. You have to pass a final assessment, at which point you can join the register, and the pharmacy technician is a protected title in the UK. So you can only call yourself a pharmacy technician if you're on the register. Currently in Northern Ireland, there isn't registration for pharmacy technicians, and that's something that we're lobbying for, because what we've found in the UK is that since registration became compulsory almost 11 years ago, it's really opened up the opportunities for pharmacy technicians, because they're seen as an autonomous profession that take responsibility for their own work, and therefore there's more opportunity for pharmacies to take on additional responsibility and to release pharmacists to take on more advanced roles such as prescribing. Next slide, please. So as part of the requirement for registration, we have to revalidate every year. And as part of that, we have to submit revalidation records to the GPHC. And this consists of planned continuing professional development entries, unplanned continuing professional development entries, a peer discussion, and a reflective account. And again, this changed about 2 years ago. Prior to that, we just had a CPD based reaccreditation process, and it's been changed to make it more rounded and to really support people with reflective practice. So of the 4 CPD activities, at least 2 have to be planned. So pharmacy technicians are expected at the beginning of their revalidation period to reflect on their practice, reflect on what developments they have in their career, in their area of practice, and identify what they need to learn, and then have a complete process of identifying how they're going to learn that, carrying out that activity, and then reflecting on how that's impacted patients. And I think in the UK, we do it quite differently to a lot of other areas, where it might be on a point system or on a certification system where you have to provide evidence of a certain number of hours. Within the UK, all of our revalidation is very much end product based, so as we have to be able to demonstrate the impact that that learning has had, as opposed to a set number of hours or level. The unplanned is those kind of everyday occurrences that support our learning and our professional development. So if we get asked a query and we're having to do research and look up the answers, we can then use that as our unplanned. The peer discussion has been a really positive and a really productive development in our revalidation cycle. The peer discussion, we have to identify a fellow professional. It doesn't have to be within pharmacy. It doesn't have to be a pharmacy technician. It has to be someone that fully understands the role that we carry out. And as part of that, you sit down, have, usually around an hour's conversation with them, just really discuss maybe what's worked well for you over the last year, what you've found challenging, and they can just really support that quite critical eye on your own practice and where you need to develop. And then the reflective account, we have professional standards that are set by the General Pharmaceutical Council, and it's the same set of standards for pharmacists and pharmacy technicians. And we reflect on those standards and identify how we have met those standards, how our practice has supported the wider profession of pharmacy. And once we've submitted all of those, they get reviewed by a review panel, which includes pharmacists and pharmacy technicians. And provided they're kind of happy that you've met those minimum requirements, you can then remain on the register for the following year, or you may be asked to resubmit or to do some additional work just to demonstrate that you've got that current occupational competence. Next slide. So post-qualification training and education programs in the UK, and one of the real opportunities of pharmacy technicians registering in the UK and having these requirements to do CPD is that it's really opened up the appetite and the opportunities for people to engage in post-qualification training. There's still not a lot of very specific to pharmacy technician advanced training in the UK. A key one that that a lot of pharmacy technicians go on to, especially if they're in very clinical roles, is we have a level 4 diploma. So the initial education and training is at a level 3. So level 4 is kind of first degree level at university. So there is a diploma which allows people to reflect on their clinical practice and to develop their practice so that they can take on more clinical roles. The majority of pharmacy technicians in the UK are employed within the NHS. And the NHS has a leadership academy, which is aimed at identifying people who are in that early management stage of their careers and developing them to be senior leaders. And increasingly, we're seeing that pharmacy technicians are taking on a lot more senior roles and management roles, and that a lot of the hierarchies are starting to move. So roles that were traditionally for pharmacists, and a lot of the management that was done by pharmacists is moving into pharmacy technician responsibilities. Within technical services, there's been a slight move to move pharmacy technicians and pharmacists out of a lot of the technical services and aseptic roles. But we're increasingly seeing that the more they're moving out, that people are seeing the value that they were adding. So there's been additional certificates added at kind of level 5 and above, so that the pharmacy technicians can take over the management and the control of those technical services departments. Within procurement and distribution, again, there's a lot of move that we no longer see in the UK pharmacists routinely being involved in procurement. That's being very led by pharmacy technicians, and we're finding that pharmacy technicians are now accessing more general non-healthcare specific procurement and distribution courses and becoming accredited with the Chartered Institute of Procurement, so that they have the kind of transferable skills to do that. And again, more general management qualifications. So we're seeing increasingly within the UK, it's not university level qualifications to be a pharmacy technician, but we're increasingly seeing people are doing degrees, are doing masters, are doing PhDs to develop their management qualifications or their clinical skills. We're having increasing numbers of pharmacy technicians getting involved in research and academia. So we're seeing that at advanced level that people are doing more and more post-qualification. And as that happens and we're demonstrating our ability to work at that level, we're seeing increasingly education opportunities that were previously reserved for pharmacists or for nurses or for other kind of degree level healthcare professionals are being opened up and available more widely. And again, within the UK, we have quite significant differences in each of the home countries. So there are different higher national certificates available in Scotland and Wales and Northern Ireland, which can make it challenging when people are trying to move between the countries, but equally it gives us a lot more exposure and a lot more information about what the possibilities are. Next slide, please. So one of the big things at APT UK that we're always kind of pushing and striving for is to find out the next opportunity for development for pharmacy technicians and identifying where those gaps are in our pathway. We've just released our 5-year strategy, and a lot of that works on identifying really clear career pathways for pharmacy technicians, because as it stands, there's not always a natural progression. You can kind of get through the first 3 or 4 years of your career with a very, very structured progression, and then you kind of have to feel your own way. And it's very clear, again, if you want to go down a management route or if you want to go into primary care, there's quite clear pathways, but there's no general clear career progression. And we're keen that that's underpinned and supported by appropriate qualifications. So a lot of the time at the moment, we kind of try and bend ourselves to fit the existing systems or to do non-healthcare or non-pharmacy qualifications that don't completely meet the need of what we're doing, but they're the closest thing that's available. So at APT UK, we're really working with education providers, with the GPHC, to make sure that those pathways and that those courses are in development so that people can have like properly accredited and visible learning. We're pushing for inclusion in programs for healthcare professionals. So in the UK, we have a lot of fellowship programs that are funded by the General Pharmaceutical Council, by the senior NHS management structure. And currently, pharmacy technicians are excluded from a lot of those just because of what those minimum entry requirements are. So we're really pushing to make sure that pharmacy technicians are included in those opportunities for advancement. We're also lobbying for a lot of legislative change to support pharmacy service delivery. It was really interesting listening to Nichole speaking about the delivery of immunisation and vaccinations. It's something that pharmacy technicians have wanted to do in the UK for a very long time. And currently, a lot of the immunisation programmes in the UK are done under a patient group directive. And currently pharmacy technicians are not included in the criteria to be able to administer vaccinations under those. And there are ways around it, but it means that we have to have a prescriber do a individual written instruction for every vaccination that needs to be administered. And what we've seen during COVID is that emergency legislation was implemented because we immediately saw that pharmacy technicians were really key to the vaccine rollout in the UK. And it was a pharmacy technician that prepared and administered the first COVID vaccine in the UK quite publicly, with quite a lot of media fanfare. So we know it can be done. And now it's that big push to try and turn those wheels to make sure that pharmacy technicians are fully integrated into that pathway. And it isn't just as part of this emergency legislation, it's something that's sustainable for the future. And another big push in the UK is to look at the models of supervision, so that where we have certainly in some sectors quite a shortage of pharmacists in the supply chain at the moment, that some of those roles that we know pharmacy technicians can do and that they've demonstrated they're able to do, making sure that the legislative framework supports that, so that ultimately patients aren't experiencing delays in receiving their medication, in receiving their treatment, that there is that appropriate skill mix and that we can support each other as fellow professions. And ensuring that senior roles are open to pharmacy professionals. And we're seeing increasingly that where traditionally jobs have been advertised as for pharmacists, that they're now being advertised for pharmacy professionals, and recognising that we're not trying to get rid of pharmacists, we're not trying to replace them, but actually working out where that skill mix is most appropriately based, so that we can support a really rounded, really rich combination of skills, so that we can release pharmacists time to do what they can do, which is that really advanced clinical level, and we can actually really manage those patient level services and the delivery of those services. Thank you.
Thank you, Catherine. That was very informative. And I think it's so interesting to learn about the differences between training here in the United States and in the UK. And it's also good to hear you talk a little bit about pushing for kind of that permanent change to allow pharmacy technicians to administer vaccines, because that's something that's happening in the US here as well. In a lot of places, it's still temporary, and there are a lot of organizations pushing to make it permanent. So thank you both for your presentations. I'm going to stop sharing my screen. That way, everyone can see all of us. And so again, for the audience, if you have questions, please feel free to submit those in the Q&A box. We did receive a question earlier that I think is for Nichole, which is that you mentioned programs offering distance learning. Can those programs be offered? This question is specific to East Africa, but in other parts of the world outside of the United States?
So as it is right now, when we mention distance learning, we really mean, because prior to COVID, it was very rare that we had programs that went remote and offered virtual learning. Most of our programs were taught on site. You go into a classroom every day or however many times a week, and that's just how you did it. And then we had a few programs that were considered distance learning programs, where they would maybe meet once a week like we do, but then do the rest online. And then we have some programs that are completely virtual and do everything online. And so since COVID, that's been a norm for a lot of programs, and people are starting to slowly roll back into. But as it is right now, I'm not personally aware of any programs that actually take students internationally, just because the regulations are so different between countries. I don't think it's out of the question, but I'm just not sure that it's done anywhere currently.
Thank you, Nichole. So Catherine, go ahead, sorry.
No, I was going to say from a UK perspective, I think we've always used far more remote training, especially in certain sectors. But I think it's that exact point that Nichole made, which is that because the role of a pharmacy technician and the initial education and training standards are so different between countries, that currently, to my knowledge, they aren't open to kind of international students.
Thank you. So Catherine, this next question is for you. You mentioned early in your presentation that just a few years ago, there was a shakeup, I think you said, related to the training for pharmacy technicians. Can you talk a little bit about how that happened, who was involved? Because one of the big differences I think that I observed listening is that in the UK, at least the initial qualification and training is pretty standardized, where in the United States, that is not the case. It really depends on where you're working. And so I'm curious about, how did that happen in the UK and who was involved in that change?
Yeah, so the General Pharmaceutical Council was established in 2010. Prior to that, we were managed by the Royal Pharmaceutical Society, and that coincided with the point at which pharmacy technicians became registered. And a lot of the qualifications were kind of legacy qualifications from before that time. The majority of pharmacy technicians, well, all the pharmacy technicians that joined the register at the beginning got grandparented over. And there was a view from the GPHC, supported by APT UK, that pharmacy practice has developed so rapidly over the last kind of 15, 20 years that there were mandatory parts of the qualification that on the ground we were kind of almost having to artificially manufacture situations, because they were things that we just don't do anymore as routine practice. It's interesting hearing around in the US that there's still a lot of non-sterile manufacturing, because that's been virtually eradicated in the UK. But so it was a really difficult thing. It was a really core part that we had to be able to do it. So we've made a lot of changes. Like, that is now a know-how. Like, we recognize that it's important to understand how medication is made, but it's not kind of the bread and butter of what a lot of people do in their roles. So it was pushed by the General Pharmaceutical Council, who were responsible for those initial education and training standards, but with a lot of support from APT UK as kind of the professional experts on pharmacy practice, on kind of what did and didn't need to be included and at what level, and making it really clear what was kind of a knowledge base and what practically someone needed to be able to do.
Thank you, Catherine. Nichole, this next question is for you. It's from Nichole in Toronto, which is, could you outline what your requirements are for the simulation portion of your training program? And then specifically, is there a lot of communication base, or is it more of a technical function base? Could you explain that more, please?
Yes, so for our simulated learning, it's both. So there's a lot of, obviously, for pharmacy technicians in the United States and anywhere, you deal with patients, or you deal, with customers, whether that be your doctors, nurses, patients coming in and out of their organization. And so we really focus a lot on customer service soft skills, being able to communicate effectively with your coworkers, your peers, with customers, patients, things like that. So we do a lot of like role playing. We have like a script, or we'll give situations and you have to react to a situation. We'll do some written analysis, like we write down a situation on paper and you have to write out how you would respond. We do some, like, what I call the telephone game, where we pretend we're calling in as patients for different needs and requirements. And our technicians have to, like, in a real time, simulate what they would say and be able to accurately describe what the patient needs. And we talk about things like, understanding the patient, listening to them, repeating back to them what they have stated their problem is, things like that. So there's a lot of focus placed on communication skills, because it is a vital process, or part of our healthcare process. So we do that. And then also our technical skills, preparing non-sterile and sterile compounds, being able to draw up an injection, being able to break an ampule correctly without stabbing yourself or someone else, being able to mix and reconstitute antibiotics, even just simple counting pills. You would think that would be something to be like, here, count these out. But people are like, I don't know, do I count one at a time? And so we teach people like the effective method on counting and packaging medications. And, we have our federal regulations and state regulations standards for how and what information has to go on a prescription and the bottle. And so we teach that and make sure people can label things appropriately. So it's a good mix of on-hand, like, technical learning, and then also like role play, communication development, and things like that. I hope that answers your question.
Thank you, Nichole. Catherine, in your slides, you talked about some of the post-qualification training that's available. I'm curious, do pharmacy technicians in the UK typically pursue those things because they want to or on their own, or are there employers that sort of drive technicians that they think might be good fits, or is it a combination of both?
think it's definitely a combination of both. I think a lot of the management can be employer led, that if they kind of see someone that they want to move into one of those management positions. I think a lot of the more clinical qualifications, and certainly when people start to look at degrees and masters, that tends to be very, very on the individual and on what they're wanting to learn and develop. So yeah, I would say the majority is very much led by the pharmacy technician themselves, as opposed to kind of externally.
And Nichole, same question for you, really. In the US, how do pharmacy technicians kind of decide what they want to pursue?
So it's really a mix of both as well. So we have a lot of pharmacy technicians that, they get that base knowledge or requirement based on their state. And then we have technicians that are always, career focused and want to advance themselves and gain that knowledge. And then we have institutions that reward for, technicians for their efforts, and getting these advanced certifications or additional certificates can open our technicians up nationally for different job opportunities. And, different employers like Vanderbilt Health System will consider technicians at that advanced level, for different management positions and different things like that. It just makes them a little bit more highly qualified. So I would say it's a good mix of both professional development requirements by the employer and then also just self-driven ambition.
So as we begin to wrap up here, I have a couple more questions for you. One is that, and this can be for both of you, so for continuous professional development or continuing education activities, if a program is designed for pharmacists, can it also count for technicians toward their professional development? So whoever would like to take that one first. Catherine, it looks like
we're
it's
both
you.
being too polite, aren't we? So in the UK, a lot of it depends on the entry requirements, especially on the more formal qualifications. There's a lot of clinical diplomas that are only open to pharmacists. Our more general professional development events tend to be open to both routinely now. Within the UK, we have CPPE, which is the Centre for Postgraduate Pharmacy Education, who has the contract to deliver all of the routine CPD courses, and virtually all of their courses, with the exception of some very specific prescribing advanced practice, are open to pharmacists and pharmacy technicians.
So I actually left this off of our presentation and realized when she was going over hers that I didn't talk about what it's like to what it takes to renew or to re-educate every 2 years. So nationally, technicians need to recertify every 2 years with PTCB to maintain their credentials. And so if you're a regular CPHT, you have to have 20 hours of continuing education. And if you're an advanced pharmacy technician, you have to have, I believe, 25 hours of continuing education credits. And so we have a national body that actually monitors our continuing education and making sure that we have the right amount of hours. We have to have specific hours in law and patient safety and things like that. And so we have an organization called ACPE that kind of generates this code or serial number for each of our trainings. And there's different letters and numbers at the end of it, almost, like a barcode type number. That tells us what category it belongs into. And so in order for a continuing education unit to count for a technician, it has to end in the letter T. So it has to have a T designation. And for it to be for pharmacists, it ends in the letter P. And so we do have conferences and certain organizations that make sure that all of their continuing education programs are certified for both pharmacists and technicians. But we definitely have certain places that just offer training for pharmacists and just training for technicians. So it's kind of both. But for the most part, some of our national organizations like ASHP and things, whenever they hold their clinical mid-year meetings and things like that, they really try to make sure every session is geared towards pharmacists and technicians. But there are some that just offer for the individuals as well.
We did receive another question via the Q&A from Mohammed, and it's actually for both of you. If someone has done a pharmacy technician diploma from Pakistan, what is its acceptability in the UK and in the United States? Nichole, do you want to go first this time?
Sure. So we actually, as far as I'm aware, still require any individual that holds a certification in another country to still go through our certification process. I believe that there are organizations that would review the criteria. As long as you have the contact hours in a pharmacy, I believe you can still sit for these exams, but you would still have to pass our national certification exam to hold that credential. And then on the state level, you would have to complete their registration process, whatever that looks like for each individual state. For the state of Tennessee, where I live, it would be a background check and some basic information, demographic information that they would capture. So it kind of varies state to state on their regulations, but nationally, you would still have to sit for and pass our national exam.
Yeah, and in the UK, the GPHC has a kind of separate pathway for entry onto the register for non-UK qualified pharmacy technicians and pharmacists. So it'd be based on a review by the GPHC of that individual qualification, and they may say that someone needs to re-go through the whole 2-year initial education and trainings pathway, or they may ask for a revalidation cycle to demonstrate adherence to the UK standards. It very much depends on where that qualification is and at what level it is. And we do get quite a few entries onto the pharmacy technician register who have registered as pharmacists elsewhere, but when they've done that assimilation, they've been moved onto a pharmacy technician kind of pathway rather than the pharmacist pathway.
All right, and so my final question for both of you is, obviously we have a lot of attendees from many different countries around the world. What advice would you provide to a pharmacy technician who is looking to learn new skills and to advance their careers within the pharmacy technician profession? Catherine, do you want to go first this time?
Yeah, I think there's real value in networking. I think events like this are brilliant, and I think it really highlights in the UK we a lot of pharmacy technicians are members of the European Association of Pharmacy Technicians. I work my day job, I do a huge amount of work in substance misuse, and when I was trying to like develop new programs, got in touch with pharmacy technicians that, you know, via social media I'd found in Canada to kind of find out what it looks like there. So I think there's real value in networking to kind of understand what those opportunities are. And I also think in kind of your like home country of finding your professional leadership body, having that real engagement, understanding. And I think when you do your continuing professional development or your continuing education, really look at the value of that. And I think it can be quite easy, and we can all get quite anxious when it's time to submit revalidation or reaccreditations, and, you know, almost that desperation to get through it, but actually really looking at the quality of that and what do you looking to achieve, and actually what is the outcome going to be of that training and that development. And I think that, you know, if you really focus on the quality of that, I think, you know, the career progression and the opportunities will naturally move from there.
I couldn't agree more. I think that networking and being a part of whatever organization is available to you, whether that be in your country or professional organization, whatever, I think it's very important to be involved. I was in pharmacy practice for like 12 or 13 years and just staffed as a pharmacy technician and didn't know anything about any other practice, and was, you know, kind of just making my way through our graduate school and things like that. And then once I started at Vanderbilt and really got plugged into our national organizations and started doing networking events and things like that, that's when the career pathways for me personally really opened up. And then I think, you know, I chose to pursue graduate education and additional certifications and certificates on my own with no real like monetary incentive or immediate benefit. I think that sometimes people get hung up, especially in our culture here in the United States, of why am I doing this? Give me something for my effort, you know? And so it's really hard to tell somebody like, this is for your growth and your professional development. So I think it's very important to approach it with an attitude of like, I'm growing myself and my career, and I'm investing in myself. I think you don't need that monetary feedback to invest in your growth and career. So I think it's definitely important to seek out additional knowledge and to really pay attention to those continuing education credits and really absorb that knowledge instead of just doing it to tick a box. Make sure that you're actually absorbing that information and using that to provide the best patient care that you can, because I feel like the people who really truly have a passion for the profession and providing good patient care are the ones that are going to generally excel. And so I think that focusing on those things while advancing yourself professionally is really helpful.
Catherine and Nichole, I think that's great advice as we wrap up our session today. I want to thank you both for sharing your expertise and opinions and knowledge about technician education and training and professional development in your respective countries. As we wrap up, I would like to just very briefly mention that today's webinar was planned by the Pharmacy Technician Advisory Committee within FIP. The Technician Advisory Committee is a group of pharmacists and pharmacy technicians who are passionate about advancing the pharmacy technician workforce. And so we advise FIP on ways to integrate pharmacy technicians into workforce development goals and other aspects of FIP projects and programs. And we're always looking for individuals to get involved in those efforts. We have a number of smaller work groups, including the one that planned today's event. We will have additional future events, both planned by FIP as a whole and specifically events about pharmacy technicians around the world. And so you can find more about those at events.fip.org if you have an interest in learning more as we plan some of these digital events. I would also like to mention that anyone who's attending today's program via Zoom will receive a certificate of attendance. And we do thank you again for your participation in today's event. So with that, I hope everyone has a wonderful day, and we look forward to seeing you at our next